Nephritic syndrome is one of the forms of presentation of glomerular diseases, characterized by the appearance of hematuria, usually with erythrocyte cylinders, proteinuria less than 3.5, edema, arterial hypertension, and reduction of the rate of glomerular filtration.
Etiology. In most cases, post-infectious glomerulonephritis is secondary to a group A beta-hemolytic streptococcus infection. However, other bacteria, viruses, and parasites can cause it. For example, hepatitis B and C virus, Epstein-Barr virus, malaria, toxoplasmosis, and staphylococcus.
Physiopathology. The nephritogenic strains produce cationic proteins that, as a consequence of their electric charge, are deposited in the glomerulus and give rise to the formation of immune complexes. In most cases, it presents a reduction in serum complement levels due to the activation of inflammatory cascade following the deposition of immunocomplexes, which will subsequently be mediated by interleukin-2, which bound to the specific receptor, causes proliferation of activated lymphocytes. This generates complement deposition and formation of perforins that increase dilation of the membrane.
This decrease in filtration is compensated by the increase in ultrafiltration pressure, which occurs because the oncotic pressure decreases with subsequent decrease of the excreted sodium fraction, and thus both sodium and water expand the volume of extracellular fluid, resulting in hypertension.
Diagnosis. The component of the nephritic syndrome that suggests the diagnosis will be the presence of hematite cylinders, elevated streptolysins during the first 10 days, and decreased C3 level. Treatment is the support and is on the way to prevent complication of water retention. Restriction of salt and water is sufficient in some cases, but often it's necessary to use loop diuretics. In the minority of cases, such treatment is not sufficient and renal replacement therapy is required. Generally, patients recover in duration 7 to 10 days. There is no evidence that use of antibiotics prevent the occurrence of glomerulonephritis. The prognosis is generally good and
Created using Powtoon.